Hi there, and welcome back. My name is Sheldon McLeod. This here is Thinking Out Loud. It's my platform at the Saltwire Network to dig into the issues, to talk about the stories that people are talking about, to talk about the things that are happening, not just in our corner of the world, but globally. We know that there are challenges with healthcare. We know that there is respiratory season right around the corner. And in fact, I happened to be in the United States just last week, and the local news there was talking about the number of children who are being admitted to their hospitals with RSV, a viral infection that affects the respiratory system. And Dr. Strang was talking a little bit about this last week. And I happened to notice that someone for whom I have a great deal of respect, who has a young child, said that they called 811 and they were advised to go to the IWK pediatric ER, and that they were slammed, that the lineup for triage went out the door. And in fact, there was a suggestion that, they said, a nurse mentioned they heard the Copaquid is closed because they have such a large influx of patients, of young children with RSV. All of this to say, Dr. Emma Burns is someone who is in the midst of all of this. She's an emergency room physician at the IWK. And you say you're the co-chief of the department. Is that what you said?
Yeah, co-interim chief. I'm going to add as many words in there as possible. Yeah.
Okay, co-interim chief. Doctor, thank you for giving some of your time to me today. And how busy is it right now at the IWK when it comes to RSV and other respiratory infections?
Yeah, I would say all respiratory infections are the culprits. So we have an RSV season every year, and we are very used to getting very busy during RSV season because it affects predominantly young children and older people. And probably the busiest months we've ever had in the history of our department were May and June of last year, and we're definitely on the upswing. And October we were like 4 patients away from hitting a new all-time high in terms of volume in our department. So we're seeing probably 140 to 150 patients a day.
Now, my kids are young adults. I don't remember a conversation about RSV when they were children, and I'm not alone in saying this seems like it's new, but it's not.
No, it's not new. This is one of the, if you practice pediatrics, it's one of our favorite things to study and research because it causes a huge burden on the hospital system, lots of distress for families, and huge volumes to the emergency department every year. And so we are, you can look back in the research and find lots of times where we've been really trying to figure out what we can do to make kids have less severe illness, what we can do to try to prevent kids from getting RSV. Are there different communities that are more severely affected by RSV? And so there's lots of stuff out there. So it's definitely not new. We are well versed in RSV. And in fact, it's one of the things that we don't even need to test for because we have a good clinical acumen of what it looks like. So we are definitely not testing every child that comes into the emergency department. And in fact, most people don't need a test. There's no reason why you need a test for RSV.
And when was this virus identified? How long has it been since the medical community has known about it?
That is a good question. I do not know the answer. Okay.
So for a while then.
I've been in practice for over 10 years.
Right.
I've been in the in the medical system for probably over 15, and it's been around as long as I have. So.
Now, as you said, last summer, there was a real push that there were a number of cases, and I'm not going to suppose why that might be, but we'd been going through social isolation. We've had our kids, perhaps not as socialized as they were prior to the pandemic. Is it fair to say that might be this is a symptom of us getting back to life as normal?
I think so. Again, I'm going to be using the word might as well, because I don't know that we have definitive answers to any of this, but we have a couple of things happening. I think we used to have a very temporally predictable peak of RSV. So we knew it started like September, October was when we needed to upregulate the number of people that were working in the departments in pediatric emergencies across the country, because our volumes would go up and it would last till February. And so it was very predictable. And now we're seeing peaks at unexpected times because of when people are going in and out of isolation. And then I agree. I think that we have a cohort of kids who did not get RSV when they were younger, or maybe even we get it every year, and for you or I, it's just one of the many colds that we get through the year, and that we're not used to seeing it, whatever that means on an immunological level, and that we're getting kids who are sort of 3 and 4 whose immune systems are not really used to it, and are getting a little bit sicker than we would have otherwise expected, and maybe even some of us are getting a little bit more affected by it because we haven't seen it in a few years. Again, I'm postulating, but that's what it feels like here on the front lines. Yeah.
And just like COVID is a virus, this is a virus. It's a viral infection. And just like COVID, it presents differently in some folks. There's, as you point out, maybe no symptoms. Others, it can be very acute, very serious. So for parents, as Dr. Wynot found out, she was directed by 811 to go to the Emerge. So what should we be looking for? When should we be worried enough to take our child to emergency department?
The instructions for RSV are not any different than they are for any viral infection in a child. So the things that we really want families to watch for, I would say in the little babies, when they stop feeding, there's generally a problem. It's either because they're short of breath or because something else is happening. So if your baby less than 6 months of age is really struggling to feed, breastfeed or bottle feed, that's a sign that they probably should be that they should be assessed. And then the other thing is we talk about work of breathing. And work of breathing is not the same as coughing. So a lot of kids will have a coughing fit, and it looks really distressing when your kid is coughing, and then they go, and they catch their breath. That's actually, to us, we're like, yeah, sure, your kid coughed a lot. In between the coughing episodes, when a child is calm and relaxed, if they're working hard to breathe at that point, so they're using extra muscles that are tugging in here, they're flaring their nostrils, they're pulling in underneath their ribs, they look like they just ran up a flight of stairs, even though they're pretty relaxed, that tells us that they're working hard to breathe, and that's always a time when you should be assessed by somebody.
And there may be a worry, a concern that the lineups, the length of wait might be very long for some people. What do you say? What recommendations do you give to people who are worried? Well, I might show up and I might wait hours and not be seen anyway.
So we're doing something which it's not unique to emergency departments, but I think in Nova Scotia, we've actually changed the way that we're triaging at the IWK. We're doing something called Pretriage, where the nurses actually check in with the families when they first arrive at the door. And we started this because we were worried about people waiting in lineups and being too sick to wait in a lineup. So we actually do a pre-triage where we check in with you, we see why you're there. And then if it is safe for you to wait, then we put you in the line for the longer triage where it's like how many days, we'll ask you more detailed questions. And we just got some data back that one of my colleagues told us about this morning, that we're doing a pretty good job of picking out the people like out of the lineup on those brief pre-triages that need to be seen and moved into the department more quickly. So even though you feel like you're waiting in the line for a really long time, those pre-triages are there to try to help and make sure that you're not waiting in the line with a child who can't breathe. And of course, if things change while you're in that line, then we recommend that you try to draw our attention to it. Understanding that the triage nurses are really like, those are a really small number of people. We've got a lot of bigger operation going on in the back there, and they are seeing every single patient who comes in. So it really is a pressure point in the emergency departments is getting through triage. But that's how we've changed that to try to help reassure families that we do know why you're there in the line. So.
And Dr. Burns, how are you and your colleagues dealing with this pressure right now at the Emerge?
Yeah, it's tough. We get into medicine because we care about people and we want to provide good care. So I would say there's lots of moral distress about like who wants to see a 2-year-old wait in the emergency department for 10 hours. Like that is not what we want to be hearing. And we know that there's lots of families who've tried really hard to find anywhere else to go, and they really can't. And so I would say our nursing colleagues are just beyond. They're really working very hard, and they have like they're being pulled from other parts of the hospital. So they're sometimes working in an environment they're not really comfortable with. And so, I would say we're feeling it. We try to stay positive, and we try to do our best with every patient that we see, but it's definitely not the ideal time to be to be working in the front lines, but we do our best every day. So.
And I don't know if it's fair to call it a wave or not, but do you feel that this has peaked yet?
No. No, we're just at the beginning. I would say Like in my experience, what happens is the emergency department is like, ooh, RSV's here, because we start seeing some patients. And then a few weeks later, we start to see it show up on the testing, because we mostly test patients who are admitted. So we, again, are kind of the canary in the coal mine. So I would say we've been seeing it for a number of weeks here in the emergency departments, and we're starting to get the testing results that prove what we were clinically seeing. Probably 25% of the tests that we run right now, mostly for patients being admitted, are being positive for RSV. And if it follows a historical trend, we probably have like 2 months ahead of us, where things are like, we're on the upswing. Things will get significantly worse over the next couple of months, and then they peter off. So that's what we're expecting. We're expecting it to be worse than other years because of these cohorts of kids who maybe haven't been getting their regular colds, who were in a more protected environment. So we have a little bit of like we're all kind of know we're in it for the long haul. So,
and do masks help protect against RSV?
Yes, they do. They would. It's a respiratorily transmitted virus, so a mask would help with that. Yeah.
And there is no specific vaccination for RSV?
There is not. There are some preventative, and again, I'm going to get a little bit out of my comfort zone here because this is not my area of expertise, but in young babies who are born prematurely, there is an RSV prevention program, because those children get more sick. So there are certain children that qualify for that RSV prevention program. That is not, our population is generally the otherwise healthy children. So I don't know as much about who qualifies and when and how, but there are some options for those children.
Well, we would advise folks call 811 if you're concerned. If you're looking for advice, never hesitate to call 911. Use your gut. I think most parents will know when it's serious enough.
Yeah.
And Dr. Emma Burns, I really do appreciate it. I always feel guilty taking a doctor away from her practice. So the education is important as well. And I really, truly value your time today. So thank you for this.
No problem.